Who was Jean Watson? Jean Watson graduated from Louis Gale School of Nursing in 1961. She received her bachelor's degree in nursing in 1964 from the University of Colorado. She then went on to get her master's degree in 1966 and her doctorate in 1973. Jean Watson has since been known for her human transpersonal caring theory of nursing in an era where caring was not valued. In the following clips are a few examples of Watson's curative factors and transpersonal caring. The nurse comes into the patient's room. It is clear that the environment is not very tidy and does not comfort the patient. It is also evident that the nurse is very task-oriented. She is persistent on taking the blood pressure when the patient is trying to express that she is uncomfortable. The nurse did not treat the patient with respect and only valued the task at hand. The nurse was not available for any further supportive assistance to the patient. The nurse enters the patient's room and she is automatically concerned with the state of the environment. She begins to clean up the bed and turns on the lights. The nurse helps the patient feel more comfortable by cleaning the bed and turning on the lights. She is ensuring that the environment is clean and comforting, thus making it beneficial to the patient. According to Jean Watson, the environment should be beneficial to holistic healing. The nurse then began to ask the patient how she is feeling. She treated the patient with dignity and respect, showing an example of transpersonal caring. The nurse was not task-oriented. She cared for the patient before starting any tasks. Upon entry, the nurse introduced herself. The nurse took the baby but did not explain what nursing tasks she was going to perform. She did not establish a trusting and supportive relationship with the client. Once the nurse began changing the baby and doing her assessment, she did not include the patient. The nurse did not address any questions the patient might have. There was no teaching done between the patient and the nurse. The nurse was very task-oriented. The nurse introduces herself. and took an extra minute to build a bond with the patient before taking the baby away to perform a task. Before taking the baby, the nurse explained to the new mother the procedure she was about to perform and asked for permission. This helps to build a trusting relationship, which is part of Jean Watson's curative factors. The nurse begins to change the baby's diaper and insists on including the mother. The mother is watching over her newborn baby while the nurse is teaching. The nurse is available to address any questions the mother might have. When the nurse completed changing the baby's diaper, she asked the mother if she had any questions. Once the baby was swaddled and returned to the mother, the nurse began another opportunity for teaching. She began to teach breastfeeding to make sure the mother would be comfortable feeding the baby. Teaching proper breastfeeding is important to the health of the baby as well as the mother. One of Jean Watson's curative factors is to promote teaching and learning. The nurse enters the room and blocks out the family member of the patient. The patient is uncomfortable without the support of her family member. The nurse has not been taking proper care of herself, evidenced by the pain in her lower back. The nurse did not take time to care for the patient or make the patient's family feel welcome. She did not take care of herself, nor did she make a supportive environment for the patient. The nurse did not make an effort to build a relationship. The patient and her family member are greeted by the nurse. The nurse takes an extra minute to give the patient and her family member privacy. She then began to make the patient and her family member feel more comfortable. By doing so, the nurse created a supportive environment, which is one of Jean Watson's curative factors. After making sure the patient and her family member were comfortable, she began to do an assessment. The nurse also took care of herself, the caregiver, by raising the bed before assessing the patient.
Waked up in the morning feeling like Jean Watson. Grab my sneaks and my scrub, I'll hit the unit, son. With my 8 doctorate degrees, I'm a nursing icon. Give attention to my patients, get my caring on.
It was 1979, caring's not in its prime, tasks are on the mind. Men ruling, thinking we're given sponge bath. Sexy nurse doesn't make me laugh. Theory of caring should be a craft.
Don't stop caring, child nurses, go the extra block. This shift, gonna lift, gonna give the greatest gift. Tick-tock on the clock, but the caring don't stop, and no.
Oh, 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 oh.
Don't stop caring, child nurses, give it all they got. 3 spheres, persons, merit, mind, body, and spirit. Tick